Welcome everyone, all our followers, all our audiences virtually. Today, we are hosting a special Instagram live on World Tuberculosis Day, which is today, March 24. And we are here to raise awareness, debunk common myths about tuberculosis, a disease which is highly preventable and treatable. But there are uh, a million misconceptions that people have in their mind, which really, uh, stop people to go and get it diagnosed on time. So, to talk about this disease, we have an incredible expert with us today, Dr. A.S. Sandhya, our pulmonologist and sleep medicine specialist from Kailash Hospital, Sector 71, Noida. And just to introduce Dr. Sandhya, she has extensive experience in treating respiratory health diseases and many sleep disorders too. So, welcome, Dr. Sandhya.
Thank you.
So, we would like you to, talk about the common myths and debunk with some facts on tuberculosis, as in, worldwide, tuberculosis has been affecting a million lives. So, over to you, Dr. Sandhya.
I'm Dr. A.S. Sandhya, consultant pulmonologist in Sector 71, Kailash Hospital, Noida. Today, 24th of March, it's the World TB Day. This is celebrated worldwide. This was the day when Dr. Robert Cox actually came up with the idea, or came up with the thing that it is a bacteria that is causing TB and not anything else. So this day, every year, we organize, we celebrate to create awareness about the TB. TB, as we know, tuberculosis is the second most deadliest disease in the whole world, and unfortunately, India has a great burden of TB diseases. Almost 29% of world TB cases are in India, and every year around 3.5 to 4 lakh deaths in India occurs because of tuberculosis. This is despite knowing they're spreading the awareness and an adequate treatment being provided already. Now, TB is not a new disease. It has been there since ages, since centuries. And still, even after having so many antibiotics for TB, we are unable to end the TB till now. This year, the World TB Day, the theme is Yes, we can end TB. And first, to end TB or to treat TB, awareness about TB is very important. TB as such is a bacterial infection caused by droplet infection from an infected person. That is, if there is a patient of a TB, he can spread the TB disease by coughing, by sneezing, by speaking through the droplet infection whenever he speaks, or coughs, or laughs, or sneezes. So if a person is near a TB patient or remains in prolonged contact with the TB patient, he has a high chance of getting infected with the TB bacteria. Now, the most common myth which we see about TB is, can TB spread by touching, by talking, by sharing things, by eating together? No. These generally do not result in spreading TB. So it is generally by the droplet infection. So whenever there is a TB patient, proper cough etiquette has to be maintained by him. A cough etiquette has to be there, that whenever you cough, you have to cover your mouth with a handkerchief or a hand or into your elbow, so that the other person does not get infected, and the same stands for TB. Whenever we talk about TB or whenever we tell a patient about TB, the first thing is, मुझे नहीं हो सकता. Everybody believes that he cannot have a TB. मैं तो अच्छे घर से हूँ, I'm from a good family. So this is the biggest myth about TB, that TB does not discriminate between caste, creed, class, or monetary status. It can happen to anyone. Any person who is near you who has been having a TB infection can infect with you. Yes, with the lower socioeconomic class, because of a low immunity, overcrowding, poor nutritional status, they have a higher chances of getting TB, but anybody can have a TB.
So, Dr. Sandhya, the major issue, why still we are having people who are, suffering with the disease, is like there are certain myths around the community. So, we would like you to, clear out these myths with some facts that can basically help those people. So, the first thing what we would like you to discuss is, is tuberculosis a genetic disease?
No, tuberculosis is not a genetic disease, not a hereditary disease. It can be only transmitted, as I said, by droplet infection, by staying in close contact with a person who is already infected with TB. So if it happens in the same family, it is because of remaining in contact with the TB patient rather than it being a genetic or hereditary.
So does TB only affect the lungs?
No, TB mostly affects the lungs because it is through the droplet infection. The portal of entry is through the lungs. But apart from the lungs, it can happen in any organ of the body, be it a brain, kidney, skin, liver, genital areas, the bones, the spinal cord, everywhere. So TB bacteria can travel through the blood to any part of the body. Now in this, patient generally thinks कि if अगर मुझे खांसी नहीं है तो TB नहीं हो सकती. They generally relate it with cough. So if it is affecting any other organ, a patient may not have cough. Sometimes even with lung infection, also patient may not have cough. So cough is not the only criteria. It depends upon which organ the TB bacteria infects.
Okay. So the most common thing which people generally like experience, people with TB, that when they are diagnosed with TB, most of the people, they do not want to be in contact with it. So I wanted to know that is TB always contagious?
The TB before the diagnosis and in the initial stages of the diagnosis can be contagious. As I said, when the patient coughs and sneezes, he can transmit the infection. But as the treatment commences, within 4 to 6 weeks, the patient generally becomes non-infective. So during this duration, it is necessary for the patient to be at a little distance, especially from the people who have a low immunity because they can transmit the infection faster, and follow the cough etiquettes. Proper nutrition has to be maintained. After that duration, generally the contagious period gets over and patient can mingle with others.
So can it spread by sharing food or any utensils or something?
No, it does not share by touching, by shaking hands, by just talking, by sharing your food, by sharing your things. It does not spread.
Okay. So generally, it is seen that like people who are taking their TB medicines, once they are not showing any symptoms, they stop taking those medications. So is it right?
TB, the treatment, we have a very good treatment of TB, but the only thing is the treatment has to be continued without any interruption. The minimum duration of TB treatment is 6 months, and depending upon the organ and severity, the treatment can extend up to 9, 12, or sometimes 18 months also. Now, what happens is initially when the patient starts taking TB medicines, within 15 days to 20 days, he starts feeling better. The symptoms starts improving. And after a month or so, the patient may actually feel like there is nothing. He's absolutely all right. And here, many of the patients start stopping the treatment. They stop the treatment. They feel, I'm okay. I don't need any treatment. And this is the worst thing that can be done. You have to complete the TB treatment completely 6 months. Even if you feel better within a 1 month or 2 months, the treatment has to be completed. The reason being that if the treatment is not completed, the bacteria, the residual bacteria, that can start growing stronger and stronger, and they can convert to a MDR TB or the drug resistant TB. Secondly, the complete course of 6 month treatment is given to eliminate any residual bacteria also, even when the symptoms are okay, so that the patient does not have a recurrence of the TB. The bacteria sometimes lie dormant and they can always recur and cause TB. TB per se can also cause various complications depending upon the organs they infect. They can damage that particular organ. So even to prevent that damage, a complete treatment is necessary. So 6 to 12 months, whatever the treatment the doctor has recommended, that has to be given. The more we take the treatment, the lesser the transmission will be there. So if we take a complete treatment, we are at lesser chances of transmitting it to our near and dear ones. So even for their protection, a complete treatment is necessary, complete and uninterrupted. That is, you have to take your treatment daily. Earlier we had it a thrice weekly regimen, but now we have a daily regimen, and every day at a particular single time, as instructed by the doctor, it has to be taken. The number of TB medicines are usually more. They have 3 tablets or 4 tablets depending upon the weight. So people may feel it is like a large number. Sometimes they omit the tablets. They take 2 tablets or 1 tablet, or they take some tablet in the morning, some in the evening. All these mistakes should not be done. It has to be taken as per your doctor's instructions.
So can it be considered deadly? Can TB be considered deadly?
If not treated at the right time with the right treatment, yes, it can. But if it is started at the right time and adequate treatment is taken, it can be completely cured.
So TB has a vaccine also, as like we know.
Yeah. We have the BCG vaccine, which is taken right at birth or within 1 month at birth. But it does not provide protection lifelong. It provides protection in the initial years of your life, but after that, the efficacy of the vaccine wanes. After the BCG vaccine, there has been no effective vaccine till date that has been protective against TB, though many are under research, but we'll wait for it till it comes.
Mm. So, like if I talk about the treatment or management of TB, with taking the medicines, do home remedies help in TB?
Antibacterials or the TB medicines are absolutely necessary for the treatment of TB. Without that, complete treatment cannot be done. Now, home remedies are helpful as in they can improve your immunity. Apart from the TB medicines, a good nutrition is very important. The patient has to be kept in a open, airy room with a good ventilation. So, whatever home remedies or natural remedies are there, they might help in the improvement of your immunity and hence recovery becomes faster. But as such, TB cure cannot be occurred.
Mhm. So, if can we categorize TB to be only affecting the poor or low income groups or people with low hygiene environment?
No, no. TB, as I said initially, it can affect any person at any time, at any place. Only thing is, the people who are from a lower socioeconomic status, they have a lower immunity because of poor nutrition, so they are at higher chances. But even if people from a good socioeconomic background, if they do not take care about their nutrition, like some people, youngsters especially, they are into dieting and fasting and everything, so they can acquire TB when the immunity levels are low. It's all a game of immunity. So if, when your immunity is higher, it's good. It can fight the TB sometimes, but with a low immunity, you can always catch TB.
So, Dr. Sandhya, we want to know, uh, patients of TB, should they be isolated from the, like healthy people?
Only in the initial phase when they're on medicines till they're infected, till the patient is having cough, till he has having symptoms. After that, maybe after a month, then he can the isolation can be stopped. It does not need to be completely isolated, kept in a different room or something. Just a distance has to be maintained, especially while coughing or sneezing, things like that.
So, if I ask like a layman, I mean, how shall a person basically know that I may have TB? What are the signs? I mean, warning signs.
The biggest thing is that TB, the infection starts very slowly. The symptoms start creeping up very slowly. So initially, when the patient has cough, fever, they might just disregard it as a normal viral infection or a bacterial infection and ignore the symptoms. But when the cough is relentless, it is persisting for more than 2 weeks, you have fever more than 2 weeks, then the thing should start coming up to your mind that this is something abnormal. Apart from cough and fever, symptoms like weight loss, loss of appetite, night sweats, fever, especially in the evening hours, when a patient has cough, blood coming in the cough, these things should give an indication that patient might have TB and he should approach to the nearby health clinician for investigation.
Okay. So, I would like, there are a few questions that are in the comment section. So, I would like to ask one. It says that does the vaccine that for against TB that's received, a 1 month child or something. So, how effective is this? I mean, like, if it is not effective, what has to be done?
Vaccine is not 100% effective and it is only the few initial years of your life that it can provide you slight protection. But even then, if you're in close contact with a patient of TB at your household, there are always chances of getting TB.
So, can TB transmit from mother to the child?
Only through droplet infection. If the mother has TB and she coughs, she sneezes, through that the child can have infection, but not genetically.
So, few more questions if like our viewers can basically come in with. Uh, We-
One more thing I would like to highlight is there is a big stigma attached with the TB diagnosis. So people always look down upon people who contract TB. So this prevents the person from actually coming up to the health clinicians, to the practitioners and getting adequate treatment. So TB is like any other disease, be it malaria, typhoid or anything, any pneumonia. TB has to be treated like that only. You have to
Mm.
remember that early treatment, early diagnosis is very necessary. Otherwise, it can become untreatable. And if treated properly, it can be treated completely. So this stigma associated with TB has to be changed, has to be removed so that everybody can come and take their treatment adequately. Whenever you have a doubt of symptoms, please go to your health practitioner. TB treatment can be provided both in private practice and in government service. Government provides free treatment for the TB, free diagnosis, free test and free treatment. And once you register with the government also gives some financial aid for proper nutrition till your treatment completes. So everybody doesn't know about this. So I would just like to make the people aware that you don't have to worry कि खर्चा होगा, treatment महंगा होगा. Everything is free from the government side.
Mm. So, can TB be cured permanently, or does it return back if a person has been?
Yes, once you have TB, it can be cured permanently, whatever the TB bacteria are there. And if your immunity remains strong throughout your life, it can never recur. But if you are again in a contact with another TB patient, a prolonged TB patient, you can get reinfected again. That is quite a possibility.
So, TB is majorly understood as only affecting the lungs. So, what are the other organs that it can affect?
Almost every other organ, from brain, ear, nose, throat, your heart, your liver, kidney, skin, and the genital areas, the uterus, every place, the bones, spinal cord, everywhere TB can be affected.
So, I mean, like, are we getting any questions? Is there any way to protect ourselves from this disease?
A good immunity, a good health status is the only thing that can protect from TB. Sometimes many of us unknowingly get the bacteria and our body fights it off. We may not even know that we were actually infected with the TB bacteria. So a good immunity goes a long way to get affected. Secondly, if there is any patient or any colleague or any household person, even if you do not know that he has a TB and you see them coughing, please advise them to follow the cough etiquettes to cover your mouth and stay at a distance till that person is cured.
Hmm. So, any specific food recommendations for TB patients?
There is no specific food recommendation. All the healthy foods are allowed. There is no parhez, as we say, this cannot be taken, that cannot be taken, nothing. All the healthy food can be given. Especially we insist on high protein diet during this time so that the recovery of the patient becomes faster. So high protein diet is generally recommended, but otherwise there is no restriction in any food. The patient can have all healthy foods, leafy vegetables, wheat protein, the egg, milk products, fruits, everything.
Okay, so Dr. Sandhya, thank you so much. This has been a very insightful session on this special day, World Tuberculosis Day. And as the nation, as the world is aiming to end TB, so this is one initiative that we wanted an expert to guide the patients as well as the common public about it. And if any tip you want to share from your end, any special advice that you want to give to people to stay preventive, stay and keep their families safe.
Almost all the things have already been discussed in this session, but as I said, awareness is the most important thing to be aware about the disease. If we see anybody, any our near dear ones, our family members, especially our household helps, the people who work at our houses, if you see them having continuous fever, continuous cough, continuous symptoms, please advise them to get themselves checked, get themselves treated immediately, and most importantly, to complete the treatment once it is started. If everybody is treated, then obviously we can end the TB as fast as possible.
Thank you, Dr. Sandhya, for joining us today.
Thank you.
Thank you, all our viewers, for joining us today live. We will keep sharing more insightful advices from our experts. Till then, bye bye. Thank you.
Thank you.